we are focusing on aseptic technique for blood cultures, a critical skill set you will absolutely be tested on during your phlebotomy certification exam. The number one goal of this procedure is to prevent contamination, which can lead to a false positive result, unnecessary antibiotic administration, and longer hospital stays. The exam will test your knowledge of the precise, non-negotiable steps required to maintain sterility. First, let's break down the skin antisepsis. The exam loves to ask about the cleaning process. It is a meticulous, multi-step procedure. You will typically start by cleansing the selected venipuncture site with a 70% isopropyl alcohol wipe to remove surface debris. Following this, the key step is to scrub the site vigorously with a chlorhexidine gluconate applicator for at least 30 seconds. A common exam trap is forgetting the importance of allowing the disinfectant to completely air dry. Do not fan it, do not blow on it, and absolutely do not repalpate the site once it has been cleaned. If you must repalpate to locate the vein, you must repeat the entire cleaning process. A standard blood culture order consists of 2 sets, drawn from 2 different sites, often within minutes of each other. Each set typically includes an aerobic bottle and an anaerobic bottle. The exam will expect you to know why 2 separate sites are necessary. This is to help differentiate between a true bloodstream infection and a contamination event. If only one of the 4 bottles grows bacteria, it's likely a contaminant from that specific draw. If both sets from 2 different locations grow the same organism, it points strongly to true bacteremia. Here is a crucial detail for exam day: the order of bottle inoculation. When using a butterfly collection set, you must fill the aerobic bottle first. This is because the air inside the tubing of the butterfly needle will be drawn into the first bottle. Inoculating the anaerobic bottle first would introduce this oxygen, potentially killing the very anaerobic bacteria you are trying to recover. While bottle top colors can vary by manufacturer, for example, blue for aerobic and purple for anaerobic, the principle remains the same. Air goes to aerobic. Volume is another critical component tested on the exam. For adult patients, the optimal volume is 8 to 10 milliliters of blood per bottle. Underfilling a bottle can lead to a false negative result because there may not be enough blood to detect a low level of bacteria. Conversely, grossly overfilling can also cause issues. Exam questions might present a scenario where a difficult draw yields only a small amount of blood and ask you which bottle to prioritize. In this situation, the aerobic bottle is generally preferred. Finally, you must know the quality benchmark. The acceptable contamination rate for blood cultures should be below 3%, with many institutions now aiming for less than 1%. The exam could present a scenario asking you to identify a quality control issue based on a facility's contamination statistics. For a memorable shortcut, remember the phrase, scrub, switch, sequence, and size. Scrub the site properly and let it dry. Switch to a second separate site for the second set. Sequence the bottles correctly with aerobic first, and ensure the size or volume of the draw is adequate. For free practice questions, AI-powered explanations, and more exam prep tools, visit openexamprep.com. That's openexamprep, all one word, .com.